So good afternoon, everyone, and I want to thank you, Governor, for letting me share this information with you. We do have 160 new cases in the state that we're reporting today. You know, just keep in mind we're not surprised by this number. This is called case finding. It's a public health strategy. We're trying to find the cases so we can isolate those who are ill, quarantine those who are exposed. So we actually want to find our cases right now. There was over 1,300 tests done yesterday, and thank you to everyone who did those tests. We now have a total in our state of 1,082 cases. There were 2 of us who passed yesterday, and that is very sad. We've had a total of 27 of us who've left with COVID-19. There was 1 person who passed yesterday in their 90s, another one in their 80s. The 1 person in their 90s did live at Golden Crest Nursing Center, and right now there's 10 associated with Golden Crest. Currently, inpatients in the hospital, that means admitted to a hospital right now, there's 109 people. Now, of that 109, 37 are actually in the intensive care unit or the ICU. Of that 37 in the ICU, 26 have a machine breathing for them, a ventilator, so that means they're intubated. So we are excited about the new partnership with CVS. This is very substantial for us, and it's great to be part of this pilot project. There's a little bit of information I want to give you about the data we're going to get. You know, we're going to learn about the positives right away, and the CVS folks have been very nice to work with us. Folks who get tested are getting some educational material about whether they're positive or negative, and we want to thank CVS for working with us on that information. It's very important. It's going to take a while, though, before the negative tests get something we can share publicly. You know, one of the things we have to keep in mind is when we started this response, and just to set context about this, keep in mind 13 weeks ago, COVID-19 was not a known or named disease. So the whole globe has had 1 season of COVID-19. It may feel like longer, but that's what's happened. And right now we're at day 37 since Rhode Island had identified patient number 1. And keep in mind, we started doing all this testing at the Rhode Island Department of Health State Laboratory, so it's really come a long way, I think, really quite rapidly here. So we did build out hospital testing. We have hospitals doing this. The private labs came on board really quickly, and they've been very helpful. But it took us days to integrate those numbers for you as well. So we're just trying to tell you, as we have this new major testing stream, and like the Governor said, we expect about 1,000 people a day to be tested with the CVS test site. It's going to take us a few days to integrate the negative results into our information. We're just going to ask you to be a little patient with us as we get that data to you. I do want to reiterate a little bit of information that Dr. Alexander Scott shared last week about wearing a cloth face mask when you're out in public. So keep in mind, the cloth face mask is not a medical grade mask. It's just something made of cloth. It covers your nose and your mouth. It can be hand sewn, or it could be a bandana, a t-shirt, or a scarf. Now, for members of our critical infrastructure workforce, this is something you really should be doing all the time. So if you're in the critical infrastructure workforce, and that's really a lot of people who are out there working right now, a good rule of thumb, if you're out there working right now, you probably need to be wearing some kind of covering over your nose and mouth. Folks who are firefighters or people in law enforcement, people who are in the manufacturing fields, people who work in the food and agricultural industry, and there's a bunch more. And one of the things I wanted to do is, I don't know if you're like me, but when I get told to do something new, I generally want to do it. But I just wish someone would tell me, how do you do it? You know, what am I supposed to do? So I brought my N95 mask with me today here. Time for a little show and tell, if you will, here. So this is an N95 respirator. I know we talk about these a lot. So we wear these in the hospital so we don't get sick, and we wear these when we're in front of our patients with aerosolizing procedure. It's a little bit different looking than a surgical mask, which I think is what most of us are used to seeing. But keep in mind, when the surgeon's wearing the mask during your operation, they're wearing that so their air that they exchange when they exhale doesn't infect the incision or the environment. So the point of a mask, the cloth covering and the surgical mask, is so that you don't accidentally breathe out, you know, aerosolized particles so you get someone else sick or on an object. Remember we talked about this yesterday, the little fomites, those little viral particles that stick on the objects we touch. So we want to make sure that when you put the mask on, it's important to cover your nose and your mouth. So I'm putting it on now. Did you notice how hard it was to hear me when I put that on? You put the elastics on, and it fits kind of snugly when you're wearing N95. It takes a little getting used to, and when you're talking, you have to learn to talk a little bit differently. But when you put the surgical mask on or the N95, it should fit snugly, but you really want to cover the nose and the mouth, and then you know you're wearing it correctly, and that'll work just fine for folks. I do want to thank some other folks who have been helping us with their response. You know, Dr. Alan Tunkel is the Dean of Medical Education at Brown, and a number of the medical students have been just so helpful when working us with contact investigations, and there's about 75 more of them helping us. Tomorrow I was interacting with a fourth-year medical student named James Sharfin, and I think it's important that we know there's a lot of people working behind the scenes, volunteering, who are smart people doing great work. And for the medical students that are helping us, I really appreciate what you're doing. I run the state medical board, and I try to represent our profession the best I can all the time. But when you volunteer like this to help people you'll never meet, that is very consistent with the highest traditions of our profession of being physicians. What we do all the time as physicians, we're other-oriented. It's never about us. It's always about what we can do for our patient. And public health is a great way to help people. So I want to thank everybody at Brown, particularly Dr. Tunkel, for all the help you're giving us.